Grant from Brunswick Veterinary Hospital, and today I'm hoping to help give you a better understanding on the role of lab work or blood work in your animal's health. Today, my assistant Adri is going to be helping me by asking some common questions that pet owners present. Adri?
Okay, thank you. My first question is, what exactly is lab work for a cat and how is it done?
So there's lots of different types of lab work that can be run in our patients, starting with more generalized tests to more specific tests depending on what we're looking for and what disease processes we're evaluating for. Common tests that we'll start with include what's called your minimum database, which is a CBC or a complete blood count that looks at your white blood cells and your red blood cells, as well as your chemistry panel that looks at overall organ function like liver, kidney, and electrolytes, as well as a urinalysis, which evaluates for any abnormalities with our urine production, as well as looking for urinary tract infections.
How does a baseline lab test impact the health and well-being of your cat?
So baseline tests are very important because it gives us a general idea of what is normal for this particular patient, or if they're coming to us already with an underlying illness or disease, where are they at that point in time? The reason this is so important is that, as disease progresses or new clinical signs arise, if we were to do blood work moving forward to further investigate, this allows us to compare back to prior blood work to say, oh, was this something that is consistent with this patient or expected with this patient, or is this something new that we should be concerned about?
Okay. What are some reasons that my cat might need lab work done?
So there's many different reasons why your cat might need some lab work done, starting with just routine lab work just to evaluate their overall health. Part of the reason being is that cats are very stoic animals, and sometimes we might not notice signs of illness until they get to a more progressive stage of their disease, which is why I do recommend at least once yearly lab work on our adult and geriatric cats to evaluate for any changes that might be too subtle for pet owners or even us to pick up on first glance.
What are some possible cat health conditions that lab work can help detect?
There's lots of different conditions that lab work can allow us to check. Starting from, more underlying and progressive diseases, just to name a couple off the top of my head, chronic kidney disease is very common in our failing patients as they age, in addition to hyperthyroidism or any kind of underlying illness like cancer. The reason why we like to do routine lab work is to check in on these guys and see, how are these levels starting to change, and is there any particular area of the body that we're now concerned about that we should be zeroing in on with our diagnoses.
What specific things are being looked at using my cat's blood work, and what can they tell the veterinarian about my cat's health?
Excellent question. So, lab work can tell your veterinarian a lot about your cat's health. Just to kind of generalize, there are lots of different diagnostic tests, but our minimum database allows us, again, to look at overall organ function. It allows us to evaluate what the immune system is doing. Do we have evidence of inflammation, infection, things like that, as well as evaluating the urine for any inappropriate changes as well. It gives us a lot of information as far as, is there progressive or new disease going on with this patient that maybe wasn't present prior.
Is blood work alone enough to ensure a proper diagnosis of cat illnesses?
So blood work alone does give us a lot of information. However, we really need a physical exam and to physically put our hands on the patient to say for sure. The reason being is that sometimes there might be some abnormalities on blood work that might just be incidental findings or normal for that particular patient. Sometimes even method of sample collection can cause some abnormalities on lab work too, and might actually not be related to any underlying or ongoing signs of illness. It is always important for a in-date physical exam to be paired with our lab work, as sometimes our lab work might suggest something that actually isn't problematic for that particular patient.
Why is early detection and diagnosis of cat illnesses using lab work so important?
It is so important to have early detection of our diseases because cats tend to be very stoic, but also our animal patients can't tell us when they're not feeling well. These guys naturally are very stoic and reclusive animals, and they tend to hide when they aren't feeling well. A lot of times we won't notice obvious signs of illness with them just because A, we don't speak their language, but B, also because they might be hiding that from us. That being said, there's also a lot of illnesses too that might be causing some discomfort inwardly, but might not actually present as any outward signs. But that doesn't mean that there isn't something brewing. It's always good to catch things early on too, because for example, with chronic kidney disease, early detection and early treatment is key for improving the quality of life for that particular patient.
Okay, well, thank you so much for meeting with me to discuss the ins and outs of cat lab work.
Absolutely, it's been a pleasure. If you have any questions, don't hesitate to give us a call.